Hi, my name is Maya Vishwanath, and I'm a ninth grade student presenting asynchronously from Katy, Texas. About 25% of the world's population has tuberculosis, and a third of those cases reside in India. As you can see from the chart I pulled from the HWO's yearly TB report, TB was among the top causes of death worldwide. Over the past few months, I've been working on a review of literature examining the India-specific societal factors that facilitate the prevalence, transmission, and persistence of tuberculosis, otherwise known as TB. These factors include, but are not limited to, the socioeconomic prejudice of the caste system and social conservatism and taboo ingrained in India's culture. I intend to highlight the cultural practices that may unintentionally aggravate the spread of tuberculosis, as well as examine the impacts of tuberculosis on poverty-stricken individuals. These impacts being the furthering of a continuous cycle of poverty, the reinforcement of patriarchal gender roles, and the impact of TB on mental health. In 2020, there were an estimated 10 million new TB cases, and nearly 95% of those cases residing in a developing country, indicating that tuberculosis is in fact a disease of poverty. TB is a latent disease, and those who are currently infected have only 5 to 10% risk of having an active infection during their lifetime. However, certain circumstances, like developing a disease that compromises one's immune system, like HIV, can increase one's risk of developing an active infection. Like most airborne diseases, TB is transmitted through airborne particles produced when a person with an active infection coughs, sneezes, or spits. In order for TB treatment to be successful in mitigating the course of the disease, both the patient and doctor need to follow a 4-month course of anti-TB drugs. Otherwise, they run the risk of developing MDR-TB. Poor quality drugs and medical malpractice can facilitate the growth of MDR-TB. As you can see from the chart I pulled from the HWO, India is plagued with drug-resistant TB, TB-HIV co-infection, and just regular tuberculosis. India suffers from overpopulation, meaning the disease can spread faster from one individual to another. Those who live in the impoverished sectors of India are often of a lower caste and are working jobs that are unsanitary and face torment from individuals of a higher caste. These conditions assist in the spread of tuberculosis. Now, on to the consequences TB has on infected individuals and families. The economic impact of TB is arguably the most devastating one, with it reaching other aspects of an infected individual's life. TB often leads to the infected person feeling lethargic and not being able to work either at their job or at home. This will lead to time off of work and a significant decrease in income or time spent away from maintaining a household. These hours are crucial to